Hi, this is Dr. Paul Martin with Brilliant Life Chiropractic, and it's time for part 3 of pregnancy and chiropractic, because I get a number of questions about this. Some of the language is a little bit hairy, or can be, for legal reasons, and also what it is that we're doing with pregnant women. So I thought I would take a moment and answer some of the more common questions that I get. I was told if I go to a chiropractor, labor could start early, and I'll have the baby before its time. Is that true? It's not true. There's no evidence to suggest that. And in fact, if anything, getting adjusted regularly will actually help you deliver at the optimal time in the easiest way possible, because it's about optimizing all those systems. It's not about forcing anything to happen. It's just about helping the pelvis and the uterus be at their best to provide the best environment for your baby. So no, that's not going to happen. Adjustments, they could hurt my baby. No, they really can't. I suppose the part of the reason that that's true is because we design our adjustments specifically to not hurt the baby, to provide the best experience for the mother possible. And we have pillows that the mother lies on that provides a space for the baby to rest in. So they're not going to get squished. We're not going to be pushing on the belly, nothing like that. And so no, there's no risk to the fetus at all. Do chiropractors actually turn babies? The answer is no, we do not. We do not turn babies. Anything that involves the baby is the practice of obstetrics, so we don't turn your baby for you. Now, what we do is focus on the mother's pelvis and the tone of the nerve leading to the uterus and uterine tone. And so what we do allows for optimal positioning, which then in turn allows for the baby to assume an optimal position, but we do not turn babies. That is not what chiropractors do. Very specific about that. And I can see why that would be confusing. Now, if you do Webster and the baby turns, if you do it again, will the baby turn back? No, that doesn't happen either. And you can think of it more like when we get the uterus tone optimal, and when we get the pelvis positioning so that it's not misaligned anymore, it just provides the perfect container. And then the baby just sort of assumes the right shape. Doing Webster again just makes sure that it's in the optimal position, and the baby will continue to hopefully assume the optimal shape. It's not going to force the baby to turn back again. It's not like flipping a switch. All right, so that will not happen. If you do the Webster technique and the baby turns, the cord could wrap around its neck. And that doesn't happen either. The baby knows which way to turn. The baby will actually turn in a way that does not allow that cord to wrap around its neck. Now, the cord wrapping around does occasionally happen. That happens with normal pregnancies. And then that's just something that your midwife or the OB can deal with, hopefully. They know how to deal with that, because you don't have to get a C-section if that's happening necessarily. But doing the Webster technique will not make the cord wrap around the baby's neck. I should only get adjusted until the baby turns, right? That's not the goal of the adjustment. Remember, the goal of the adjustment is to ensure proper pelvic positioning and optimal tone of the uterus. So the goal isn't necessarily to make the baby turn. Now, does that happen after doing the Webster technique? It has been known to happen. That's not the goal of care. The goal of care is to provide the optimal environment for the mom and the baby by adjusting the baby. So if you want what's best for your baby, then my advice would be to get adjusted for your whole life, really. But really, get adjusted throughout your pregnancy. That'll allow for an optimal birth. That'll allow for the best environment for your baby, and then your baby will be the healthiest when they are born. So get adjusted for as long as you want a fully functioning nerve system and optimal health, however long that is for you. How many visits will it take for the baby to move? I don't know. That's not something I can predict. That's not the goal of care anyway, as I've said before. Sometimes people report back, oh, happened right after the first one. Happened immediately after the adjustment, right there on the table. That's happened too. Sometimes the baby doesn't move. Sometimes the baby doesn't turn. Because remember, that's not the goal of care. And I really can't predict how many that is. Also, I've heard people ask me like, oh, I've heard that if the baby doesn't turn in 4 adjustments, it's just not going to. Well, again, that's not the goal of care. And it's also not true. Sometimes we've had babies be really, really stubborn, never turning until like the day before they go into labor, and then boop, it all turns out just fine. Then the last question I get sometimes is, hey, can you check to see what position the baby is in?